your host, Amberlynn Carroll. Thank you for joining us on this episode of Medwatch Today. Community health system's top priority is patient care and safety. A big part of that is ensuring facilities meet every state and federal regulation. And California is requiring that hospitals meet updated seismic standards to strengthen buildings in the event of an earthquake emergency.
State law requires that hospital buildings remain standing after an earthquake. This means that people will be safe, and hospitals also have plans to continuously care for patients. Already, nearly all California hospitals have met this first set of requirements, and the last will by the end of next year.
Community Regional Medical Center in downtown Fresno met the requirements set forth by the 2020 seismic mandate. Now, California hospitals are being challenged to meet the new requirements by 2030, primarily focused on infrastructure.
And under the upcoming 2030 deadline, hospitals are required to make additional expenditures to further strengthen their buildings. The problem is that is simply unrealistic. Hospitals have experienced significant losses due to the COVID-19 pandemic and extraordinarily high inflationary pressures when it comes to everything from workforce to pharmaceuticals and supplies.
The California Hospital Association represents more than 400 hospitals throughout the state and worries making the updates mandated in this 2030 legislation would mean that not all California hospitals will survive.
Only about a third of California hospitals have been able to meet the requirement, which means 2/3 of hospitals in the state have not been able to meet that additional requirement. Hospitals are required under state law to close their doors forever if they cannot meet it. This requirement is forcing hospitals to choose buildings over the very real healthcare needs of their communities.
Historically, seismic activity in the Fresno area is among the lowest in the state, and studies by the United States Geological Survey conclude the risk of damage to structures in the region is low if a large earthquake were to strike at any time.
Time is so important when you're talking about getting medical care, and it can make all the difference.
Community Regional is the Valley's only Level 1 trauma center and one hospital navigating these very real challenges.
The Level 1 designation makes us different from other hospitals in that we have around-the-clock physicians here.
And to be compliant with the new 2030 seismic mandate would cost the hospital $2 to $3 billion.
A significant portion of our beds would go away if we're not compliant. We would not get one single new bed out of that. There's always far more demand than we have capacity. So the thought of removing even one bed is detrimental.
That's why advocating for change to the seismic mandate is so important. Allowing lawmakers to see from the vantage point of regions like the Central Valley is crucial to keeping care local and accessible.
Any threat to this place, we get pretty passionate about and personal about because we see the good, the great good that's done here. It doesn't matter who you are or how much money you have, you're still going to get the same high quality of health care here in this place.